Hello, welcome to ANA community. From the past several videos, we have discussed about the concept of Bahya Srotas. Initially, we have started with the Asya, then followed by the Nayana. Today, we are going to discuss the Bahya Srotas as Nasa or nose. Nasa or nose is one of the 9 Srotasas which are considered to be essentially important in specifically in the Urdhva Bhaga or Urdhvanga Sharira of the human body. This is responsible for the Grhana Jnana or perception of the smell or smelling the different objects. Tarpaka Kapha and Pranavata are helpful in the proper functioning of Nasa. Why this is very important is the in terms of Ayurveda, that is administration of Nasya, that will be done with the help of the medicated substances which will be instilled through nose. Why this is that much important? That is being mentioned in Ashtanga Sangraha. That is Nasahi Shirasodwaram. That means Nasa or nose is considered to be one of the entry point for the Shiras. That means the most of the diseases which an individual is suffering from in relation to head and neck, etc., we are going to administer the medicine through nose or nostrils. That is why this is having that much importance. When we look into this particular NASA, we are going to look into the different brief functional anatomy of the nose as such. So here, we are going to see specifically this is what is considered to be the nostril. So here there will be the nasal hairs that will be present, which is actually helpful in the prevention of the certain dust particles, etc. So this is what we can say about the external nose, and then comes the nasal cavity. Nasal cavities that is having the 3 different turbinates, that is considered to be the superior turbinate. This is superior turbinate, middle turbinate, and inferior turbinate. When you think about these are again the other barriers which will be preventing the entry of the dust particles or microorganisms, etc. So inferior turbinate is having the one that is the lacrimal duct opening, and second one that is the Eustachian tube opening. So which is actually responsible for the one that is the entry of the lacrimal secretions into the nose as such. Whereas the other one, which is the Eustachian tube, which is having the other opening in the middle ear. So that means the equalization of the pressure, that is air pressure, that may be possible by this particular Eustachian tube. The other one, that is the area that is considered to be olfactory nerve ending, where that will be present, that is olfactory nerve is present, which is actually responsible for the perception of a smell. So when you look into the whole nose as such, this is actually responsible for the entry of the air from the nasal cavity into the respiratory passages. So plus that is the another major thing, that is the warming of the air that will be possible because of increased blood circulation into the nose, plus the humidification of air will be possible because of this particular the functioning of the nose is concerned as far as the homeostasis is concerned. The other areas, so there may be a possibility of frontal nasal sinuses and maxillary nasal sinuses, ethmoidal nasal sinuses that may be present here, and maxillary sinus that may be present on the either sides of the maxillary region. This is what is considered to be the soft palate, hard palate, and this is considered to be soft palate. This is tongue, This is epiglottis, and this is considered to be the, what do you say, that the respiratory tract, and this is considered to be the alimentary canal. So these are the, when you think about this, the air will be entering from the nostrils, and that will be entering into the respiratory passages. So the air, the smell that will be entering from this, and that will be entering into this particular olfactory mucosa, and that will be responsible for the smell perception. Whenever the person is having nasal blockage, this particular, the movement of this particular objects from the nose into the olfactory nerve endings, that will be blocked. Thereby the person may not perceive the smell perception. And whenever the person is having lacrimal duct obstruction as such, there may be a possibility of secretions that can happen, that will be observed in the nasal cavity. The person is having ear infection, etc. This may lead to the Eustachian blockage. Thereby the person will be having the pain on the side of the ear where there is the, in the Eustachian tube blockage is being observed. As far as Nidana of Nasa Roga are concerned, Ashtanga Hridaya Uttaratantra says, Avashyaya Nilarajo Bhashyati Swapna Jagarehi Nicha Atyachapodhanena Pitenanyena Varina Atyambupana Ramana Chardi Bashpa Vigrahadibihi Krutham Atulbana Dosha Nasayam Sthanatam Gata. So when you think about this, Avashyaya, Anila, Rajo, Bhashya, Atiswapna, Atiprajagaraihi, Nicha Upadhanena, Ati Ucha Upadhanena, Pitena Anyena Varina, Ati Ambupana Ramana, Chardi Bashpa Grahadebihi, Krudha Vatulbana Doshaha, Nasayam Sthanatam Gata. Sthanatam in the sense, the solidification of the dosha that is going to take place in the nasal cavity. Now we are going to look into these different aspects in brief as such. What is this avashyaya? That is cold air exposure. Whenever the person is having the exposure of the cold air into the nasal cavity, so that will be responsible for the dryness of the nasal mucosa. Thereby the person will be having the crust, that the solidified crust will be observed in the nasal cavity. And anila, that is air exposure. This is actually responsible for the dryness of the nasal mucosa, and if it is mixed with the dust, etc., this will be responsible for the inflammation that to happen in the respiratory passages. The rajas or dust exposure, when this is being observed, naturally, so this will be responsible for the sneezing initially. This will be followed by running nose as such. So that means the clinical presentation in the chronological order will be, initially there will be sneezing. This will be followed by running nose. Later this will be followed by nasal blockage. This may be followed by the loss of perception of smell, or the pain in the ears, or post nasal drip, etc. So these are the different clinical manifestations that may be possible in case of, what you say, that the rajas exposure, depending upon the quantity as such. Lesser the dust exposure, simple running nose, simple sneezing may be there. More amount of the dust passages as such, there may be a possibility of nasal blockage or pain in the ears may be possible. Bhashya, excessive speech. So that means this will be responsible for the sympathetic nerve stimulation, which is resulting in the reduced secretions may happen in the oral cavity as well as in the nasal cavity. Thereby the person may have the disturbances may appear in the nose as such. Excessive sleep. This may be responsible for the parasympathetic nerve stimulation. When there is parasympathetic nerve stimulation, naturally the secretions may happen in the oral cavity and nasal cavity, that is going to get increased. Thereby the person may have the nasal blockage or post-nasal drip, etc. that can happen. Atijagarana, excessive awakening, specifically at night time. This may be responsible for the increased what you say that the sympathetic nerve stimulation, which is responsible for the dryness of the nasal mucosa may happen. Nicha upadhana and ati ucha upadhana. So that means the too little support to the head or too much support to the head may be possible. So this may be responsible for the pain in the neck region as such, which may in turn may result in the disturbances may happen in the nasal cavity. Anyavari pana. So that means consumption of the water of the other sources as such. This may be responsible for the uh, inflammation or infection to happen in the nose or paranasal sinuses. Ati ambupana. Excessive consumption of water. Ati ramana. In the sense excessive luxurious activities. For example, living in the AC room. Naturally, the person will be inhaling the cold atmosphere, the cold air. Thereby, there will be a possibility of nasal mucosal drying. Chardi. So that means vomiting. Sometimes this particular vomitus may enter into the respiratory passages. What we can say nasal regurgitation may be possible. Thereby, the person may have the uh, exit of this particular food substance through the nasal cavity also. So this may be resulting in the inflammation to happen in the nasal cavity. Bashpagraha, that is suppression of the tears. This may be responsible for the backflow of the fluid, as we have discussed in the previous functional anatomy. There may be a possibility of the backflow of the lacrimal secretions that will be observed in the inferior nasal turbinate region. Thereby, the person will be having the nasal secretions to happen through the nostrils. These are the possible nidana that, or what we can say, the etiological factors for the Nasa Roga manifestation. As far as the significance of the dust Nasa is concerned, this can lead to the entry of different etiological factors such as dust, smoke, water during swimming, or during the what do you say that the administration of the what do you say that in case of the yoga, Navli Kriya, etc. So, and regarding that is performing the Shitkarma and any other foreign particle entry such as coin, sometimes the rice tube, etc. Sometimes even the nails, that may lead to the damage to the nasal mucosa may have, or otherwise there may be a possibility of entry of the food from the alimentary canal into the nasal passages. So these are the different ways where there may be a possibility of the affliction of the nose as such. When you think about the Ayurveda point of view, the Nasya administration, it is being mentioned in the Ayurveda as Nasa hi Shirasodvaram. So that means administration of the oil in the nasal cavity. For example, in the person suffering from the Vata Vyadhi, specifically Pakshagata, we are going to give the Nasya or the what do you say that the Pratimarshanasya in some of the occasions, or the Marshanasya or Pradhamananasya, where the powder that is going to get instilled into the nasal cavity. If that is not being done by following the proper Snehana or Svedana, that means proper standard operating procedure is not being followed, then there may be a possibility of the nasal discomfort or the much nasal diseases may be possible. So this will lead to the entry of pathogen that can happen into either into the trachea or into the esophagus. So that means the nidana that may enter into the pranavaha srotas, or that may enter into the annavaha srotas later. That is the reason the person who is having the sputum, etc., we are preferring to expectorate it, not we are not preferring to swallow it, because there may be a possibility of the entry of these microorganisms through the sputum etc. into the alimentary canal. So to prevent these entries, barriers are being present in the nose and nasal cavity at multiple levels, starting from the nostrils, which is having the abundance of the nasal hairs, so which will be actually preventing the entry of the dust particles. The smaller dust particles still they enter into the nose, which are going to get prevented by the turbinates, superior, middle, and inferior turbinates. Further, there will be the presence of the cilia in the respiratory epithelium. They are nothing but the hairs present in the respiratory passages, which are again responsible for the expectoration of the what do you say that the excessively formed sputum as such. Further, even the smaller particles they are going to get attached to the respiratory mucosa. Thereby, the person will be having the irritation of the respiratory passages if the particles of the pathogens are becoming minute in size. So like that, the stasis of the pathogen may happen either in the nose, which is responsible for the nasal blockages as such initially, or the person will be having the movement of the LNSI. And if the pathogens are entering into the nasal cavity, the person will be having the imperception of smell. The person will be having the what do you say that the pain in the ears, so which is indicative of the eustachian tube blockage, and the person will be having the sneezing, the person will be having the nasal blockage, the person will be having the post nasal drip, the person will be having the sputum production as such, so which are responsible for the multiple signs that can be observed, such as hypertrophy of the inferior nasal turbinate, a pink colored swelling observed from the lateral side towards the middle part of the nose, towards the nasal septum. There may be a possibility of redness that can be observed in the nasal mucosa, which in turn results in the increased nasal secretions, so which in turn results in the paranasal secretions, which will be leading to the nasal blockage as such, and with this is indicative of the intracellular compartment involvement. Suppose if the pathogens are entering from the nose into the stomach as such, this may lead to what we can say the Nija type of the Vikara. As we have discussed, any pathogens, if they are having the interaction with the hydrochloric acid and other gastric juices, they are responsible for the Nija type of the Vikara, because they are responsible for the dosha vitiation may occur there. Take home messages from today's discussion are: Nasa is considered to be one of the Bahya Srotas which gets afflicted when the person is having the exposure to Rajas, Dhuma, Nasya, what we can say the medication administration through the nose, Chardi, that is the reverse peristaltic movement leading to the deviated entry of the food substances into the nose rather than into the mouth. These are the conditions, these are the possible causes which are actually responsible for the disturbed functioning of the nose, which in turn results in the deviated entry of pranavata, or the stoppage of entry of the pranavata may happen. It is being mentioned that Nasa hi Shirasodwaram. Nasa is considered to be one of the main entry point for the Shiras. That is why any kind of the medicines, if they are going to get administered through the nose, that will straight away enter into the shiras itself or head as such. The clinical presentation in such a patient may vary from simple running nose to most life-threatening copious amount of nasal bleeding. These are actually happening because of the two main factors. One, that is the depending upon the number of the pathogens entering through the nose, and second, due to the virulence of the pathogens entering through the nose. Dear community, that's all for today. Mention in the comment box below what are the major key takeaways from today's discussion. What is the one video that you'd like to hear in the coming days? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.